My feeling is that Dr. Leo Malin is one of the most incredibly well-trained individuals I know that teaches here at Las Vegas Institute of Advanced Dental Studies. It comes through very early when one sits in on his lectures that he's very well grounded in the approach to the patient, the diagnosis of the patient. And that is very important, that you don't just put implants anywhere. They have to be based upon a very sound anatomical knowledge. And of course, in that, the ICAT has become very important. And Dr. Malin is not only therefore tremendously knowledgeable in the workup of the patient and what implants, what is required for a successful implant, but he also knows about the ICAT procedures by which the implant is placed in a very strategic position, and it is very strategic. It has to be within a few millimeters of the adjacent teeth and within millimeters of the front of the buccal or facial bone as opposed to the lingual or palatal bone. And he's very, very knowledgeable and an extremely easy manner of teaching. He's just a remarkable man all around. I would say it's essential. The loss of teeth or the decay process usually leaves just a tissue that is non-vital. It's not alive. It's a dead tooth. And up to recent times, what we have done, we've tried to hang on to these teeth by a process called root canal therapy. But it is well known that when you go down, and Dr. Malin talks about this, when you go down around the tooth or within the tooth, the dentinal tubules, the dentine that is a source of incredible infectious material. And to eliminate that infection is not really achieved, because the root canal therapy attempts to seal off everything, but it hasn't necessarily removed all the bacteria within the dentinal tubules. So the tooth eventually breaks down, fails, and now a patient has no alternative but to extract the tooth and to replace it, up to this time, with dentures, prosthetic appliances. And now we not only can improve the stability of those prosthetic appliances, but now we are using an implant that is non-infectious, which has not been achievable before. So that is a tremendous stride for any dentist. So every dentist should take notice of what's going on at Las Vegas Institute, not only because of the implants, but also because it's placed into a situation where we are altering the bite. And when I was a student, which goes back, we were told you can never change the bite. Now we know you can do it as long as you understand the physiological principles. And that's what comes to light. What comes to life is Dr. Malin's approach to both the implant and also how you can build the correct bite on that implant. And that's a bringing together of procedures that you will find not done anywhere else in the world, anywhere else in the world. Now, that's why I say come to Las Vegas Institute.